In this presentation, we'll delve into the objectives and components of the secondary patient assessment. This thorough examination is crucial for identifying any conditions that the primary assessment may have missed. Our goals are to record vital signs, collect a detailed patient history using the SAMPLE acronym, perform an exhaustive physical examination, document our subjective and objective findings on a SOAP note. Now, remember, the order in which you conduct these components is flexible and can be adapted based upon your situation. You can record vital signs, collect sample history, or perform the physical exam in any order. Vital signs are our first window into the patient's condition. They include time, level of consciousness score, heart rate, respiratory rate, and skin condition, color, temperature, moisture. Sample history. The sample history is a systematic approach to gathering medical history from the patient. SAMPLE is an acronym that stands for S, signs and symptoms, A, allergies, M, medications, P, past medical history, L, last in and last out, and E, events leading up to the illness or injury. This information can be invaluable in understanding the patient's current condition and medical background. The physical examination in the secondary assessment is a more thorough than the physical exam we performed in the primary assessment. It involves a head-to-toe check to identify any injuries or conditions that might have been missed initially. As part of the secondary assessment, documentation is key. This is where SOAP notes come into play. SOAP is an acronym that stands for S, subjective, what the patient tells you about their condition. O, objective, what you observe and measure, such as vital signs. A, assessment, your evaluation of the patient's condition. P, plan, your planned intervention or treatment. Completing a SOAP note is crucial for effective patient care and communication. And we'll cover how to complete a SOAP note in a separate presentation. The secondary patient assessment is a vital component of wilderness first aid that allows us to gather comprehensive information about the patient's condition. It forms the foundation for effective patient care in remote settings, along with our SOAP notes. In our next session, we'll dive into the specifics of completing SOAP notes and how they integrate with the patient assessments to assure continuity and clarity of care.